provincial government launched Let Every Apayao Home be a center for health and better nutrition, a special interagency collaboration of nutrition programs and services. Apayao had established, operated, and managed its own child development center within the capital to cater to the childcare needs of government employees and other nearby households. They also provided the child development centers with equipment, fixtures, supplies, and materials. The province also continuously implemented various programs, projects, and activities despite the COVID-19 pandemic to provide holistic child development. Implementing policies and programs for child welfare development involved concerted efforts, interaction, and cooperation among all sectors in the province. It is a multi-sectoral partnership with concerned agencies from the national government operating in the province, including the local government units, the communities in the barangays, families, and a private organization. Despite the pandemic, the province also continued to undertake different programs or projects and activities around the province to promote children's holistic development, such as the following: continuing allocation of funds for the construction, improvement, and repair of child development centers of barangays province-wide; provision of learning materials and school supplies for daycare children; provision of the ECCD checklist; provision of supplies for child development workers' modules and their capacity building activities; conduct of accreditation assessment of child development workers and child development centers with DSWD CAR staff; maintain sanitation, cleanliness, and orderliness inside and outside the center through food for work of daycare parents. Safe Motherhood Program. This focuses on the safety and welfare of the mother and baby throughout pregnancy until 42 days after delivery. This program aims to provide Filipino women access to quality health care for a safer pregnancy and delivery. Immunization Program. The government established the National Immunization Program to ensure that infants, children, pregnant women, and senior citizens have access to routine immunization and to prevent the outbreak of vaccine-preventable diseases. COVID-19 has brought many challenges in delivering health services, including the usual conduct of face-to-face immunization. Hence, house-to-house immunization is conducted as an alternative to ensure that target beneficiaries are consistently provided with treatments. Oral Health Program. The Provincial Health Office Dental Division is still dealing with the aftermath of the COVID-19 pandemic. This appears to be the most difficult point that has confused dental practitioners, particularly the dentista ng bayan, even though dental facilities immediately began to adapt to the unexpected COVID-19 crisis. Due to the nature of clinical treatments which require operating on the patient's oral cavity, primarily aerosol-generating procedures, dental professionals are considered to pose the highest risk. Population Development Program. The central idea of the program is responsible parenthood. Orientations are toward the overall improvement of family well-being, not just concerned with fertility reduction. It also covers family welfare, including that of individual interest. The program promotes family development and responsible parenting. Child Development Services. The provincial government of Apayao had established, operated, and managed its own child development center within the capital to cater to the childcare needs of government employees and other nearby households. The provincial government provides all the CDCs with equipment, fixtures, supplies, and materials. In recognition of the full realization of the rights of every child, the provincial government of Apayao is committed to serving as a champion for early childhood care and development. Support programs and policies across sectors including health, nutrition, education, care, protection, participation, and rehabilitation of children in difficult situations will continue. These programs and interventions promote and ensure every child's social and overall well-being and help them grow and reach their full potential.